So you've been scheduled for a thyroidectomy procedure. The purpose of the thyroid surgery is to remove your thyroid gland. You've either been scheduled to have half of your thyroid gland or your whole thyroid gland removed. Thyroidectomy is a procedure that takes anywhere between 30 and 60 minutes to perform. The incision can range anywhere between 2.5 centimeters or 1 inch to 3 or 4 inches, depending on how large the thyroid gland is. Surgery is a relatively uncomplicated procedure. The purpose of the surgery, like we said, is for the thyroid gland to be removed. The surgery may be performed in an outpatient setting and you may go home the same day. Sometimes, in rare cases, if you have medical conditions, it may be required that you stay overnight. The surgery involves a 30 to 1 hour long procedure that will initially make a small incision and then remove the thyroid gland. Sometimes fluid can accumulate in the area where the thyroid gland was removed, requiring a drain to be placed. This has to be done about half of the time. Post-operatively, you recover in the recovery area for anywhere between 30 minutes and 2 hours, depending on how quickly you recover from surgery. In the outpatient setting, you go home. If a drain is left in place, you will have to come the next business day to one of our offices to have the drain removed. If a drain is not left in place, you'll come back 1 week later to discuss the results of the pathology from the thyroid gland being removed. Major risk of the surgery are two. Outside of the risk from general anesthesia and from surgery as a whole, which you have read in your consent, the major risk from thyroidectomy procedure are: number one, injury to the nerve that innervates the vocal cord. You have two nerves that run on either side of your thyroid gland, called the recurrent laryngeal nerve. They can sometimes be injured during surgery, and if they were to become injured, it could result in hoarseness. That hoarseness could be temporary or it could be permanent. This is an extremely rare complication, and it happens very infrequently. Overall, nationally, the rates of this happening are anywhere between 1 to 3%. At our center, the incidence of this happening are less than 1%. If both the nerves were to become injured, it could be devastating, requiring something called a tracheostomy tube. Again, that is an extremely rare risk, but it is something that I need to discuss with you. The second risk of surgery is potentially a drop in your calcium level. There are 4 glands called the parathyroid glands that deal with calcium metabolism. They can sometimes get injured during surgery, and it could take time for that injury to recover. That could result in your calcium levels dropping. In the postoperative instruction sheet that you'll get, it will be described on how to prevent that from happening by taking oral calcium supplementation for 1 week. Additionally, in your postoperative instruction sheet, it discusses wound care and also medications that you will need after surgery, including pain medication. Please be sure to read these before surgery and also after surgery and share them with family members. We expect that your surgery will be uncomplicated, and our outcomes at our center are very good.
This video is presented for general information purposes only. No attempt is made to include all significant risks and benefits of surgical procedure and may not apply to a particular patient. Review with your physician any questions before signing the informed consent form.